is Janet Mendez. I'm a respiratory therapy student, and I'm here today to perform a trach care. The first thing that I'm going to do is I'm going to check the chart to check physician's order. So I'm going to check patient's name, the date of birth, and the medical record to make sure that I have the correct patient for the order that it was done. So now that I know that I have the doctor's order, I'm gonna go ahead and I'm gonna make sure that I have all the equipment. So I'm gonna gather the necessary equipment for this procedure. I need to have a suction equipment. I need the BBM. I need the trach care kit and the trach tie. So I'm gonna go ahead. May I come in? Hi, my name is Janet Mendez. I'm a respiratory therapist student. I'm here today for doctor's order to perform a trach care. Is that okay with you? Okay, so can I please check your identification? So I'm going to check on the patients. I'm going to check patient's name, date of birth, and medical record. Now that I know that I have the correct patient, I'm going to go ahead and wash my hands. This time I'm going to choose to use hand sanitizer. So I'm going to rub my hands for 15 seconds or until it's dry. When it's dry, then I'm going to don my gloves. When I have my gloves on, then I'm going to get all the equipment and I'm going to connect the BBM to the oxygen source. And put it at 15 liters per minute to have it ready. Also, I'm going to connect my suction tube with a young copper for oral suctioning in case it's needed. And I'm going to make sure that I have the correct pressure for adults. In this case, is -100 to -120. Now I know that I have the correct pressure, so I have it ready also. Like I said, if I need oral suctioning on the patient. So now I'm going to sit up my patient, the father's position. And then I'm going to go ahead and I'm going to start my vital signs. I'm going to assess the patient. So I'm going to check respiratory rate, heart rate. Also I'm going to apply pulse oximeter to check oximetry in the blood, and also I'm going to check breath sounds. Now that I confirm that the lungs are clear, then I can start the procedure. Before that, I will check if there's any suctioning that needs to be done, like oral or tracheal suctioning, or with a young cover. If I need tracheal suctioning, I will use the suction catheter. So I'm going to go ahead, I'm going to open my trach care kit. This has to be done in a sterile environment. So I'm going to go ahead, open this, and then I'm going to dump everything that is inside the trach care kit on top of that. Then I'm going to get aside everything that doesn't need to be sterile out of the sterile place. And then I'm going to go ahead and prepare. On this one, I'm going to put half peroxide and half water for cleansing, and then on the other two I'm going to just put water for rinsing. So once I've done that, what I'm going to do is I'm going to make sure to have sterile gloves on before even starting the procedure. So I'm going to don my sterile gloves with the proper technique. then I'm gonna unlock. I remove the inner cannula and I'm gonna dump it into the water with peroxide. So what I'm gonna do now is I'm gonna take the patient's dirty gas out, and then I'm gonna start with one of the Q-tips. I'm gonna use water with the peroxide and water, and I'm gonna start cleaning the trach flange, all the outside area. And then I'm gonna get one of the gauze. I'm gonna also get some of the solution with peroxide and water, and then I'm gonna clean the skin area around the trach and under the flange. Then I'm gonna get another Q-tip, and this time I'm gonna dump it in water, just water for rinsing. So I'm gonna rinse the trach flange, and then I'm gonna get another gauze, now with only water, to rinse all the skin area around the trach. So the patient is not left with peroxide, because this can cause irritation. Now that it's completely rinsed, then I'm gonna just get a dry gauze and check that everything around that area on the trach, under the trach, flange is completely dry and no humidity is left. Now that everything is clean and dry, I'm gonna go ahead ready to start changing the trach tie and put a new gauze under the trach flange. So I'm gonna untie one side. Start tying the new trach tie or trach holder. I'm gonna attach the new one with the old one, so it's easier to go around the neck to the other side. And then I'm gonna tie as well on the other side. And then as well, I'm gonna put gauze under, so in between the trach flange and the skin of the patient's skin. Now the trach is again secure and everything is clean and dry. So I'm gonna go ahead and then I'm gonna start cleaning the inner cannula. So I'm gonna brush the inside of the inner cannula both ways, and on the outside, make sure that there's no secretions left, so it's already clean. Once I'm done brushing, what I'm gonna do is I'm gonna dip it in water, so it gets rinsed, and then I'm gonna ensure there's just no peroxide left, because like I said, it's very irritating. So I dip it in water again, and then I'm gonna air dry it for a little bit, and then I put it back into the patient's tray. And we lock it again. Now that it's locked, I'm gonna go ahead I'm gonna disregard my sterile gloves. And then I'm gonna go ahead, I'm gonna check my patient's vital sign. So I'm gonna check again, respiratory rate, heart rate, check pulse oximeter, and also breath sounds. I'm sure that the lungs are clear, all the breath sounds are fine, so I'm gonna go ahead and I'm gonna make sure that the patient is comfortable. I'm gonna put it again in the position that I found him, if it is comfortable that way. So once I'm done, then I'm gonna go ahead and I'm gonna disregard all the equipment that it was used for this procedure and throw it away in a biohazard bag. And then I'm gonna just pick up all the equipment that it was put in case it was needed during the procedure. Now that I'm done, I'm just gonna take my gloves off. Again, I'm gonna disinfect my hands with hand sanitizer. And then I'm ready to just say goodbye to the patient. Is there anything else that I can do for you? And then I'm gonna go ahead, I'm gonna go out and chart on the patient chart all the procedures that it was already done.